Hello, my name is Diana Lukey. I am the PR and marketing specialist for American Income Life Insurance Company. We have a wonderful program, and I'm so happy that Mr. Middleton allowed me a few minutes to share a program with you that could really help Omega Psi Phi Fraternity Federal Credit Union increase product use per member, generate some income, and also provide a valuable need for your members. I'm going to share my screen so you can kind of follow along with the presentation. And hopefully you will be able to see it. Just a little bit about American Income Life. Oh, there it goes, sorry. We are a supplemental insurance company. We have been around for almost 70 years. We are headquartered in Waco, Texas. I work the state of Georgia, and we are in the United States, Canada, and New Zealand. Basically, our program is designed to help strengthen your credit union. Why is it important? We have a lot of services and benefits that can really enhance, like I mentioned earlier, product use, generate income, and just be a true partner for your credit union. The services and support that we offer can really expand income generating programs through non-interest and interest income, increase product per member, member retention, potential new member growth, which I know that's something that's very important to you, and also enhance your community profile. The things we offer in our program are a $2,500 accidental death and dismemberment coverage. That is for all members. Nothing has to be done. We don't have to opt in or opt out like other credit union or other insurance companies offering. Ours is a blanket policy covering all members. Every credit union member will receive the $2,500. We also offer child safety kits, which are 10 fingerprint ID kits that can help if a child goes missing and works in conjunction with the Amber Alert. We also have an app that goes with that parents can put on their phone just to keep that data sensitive and in their control. We have an AIL Plus health service discount program, and that is for things for prescription, eyeglass, contact lenses, chiropractic, hearing aid. There's a variety of discounts that you can get. Those are point of sale. So the members do have to sign up for that in order to get that benefit. And lastly, we have a family information guide, which I will review in just a moment. This is a sample of the child safety kit, which you can see. This is the app, if you can follow along with my mouse, my cursor. This is also just the paper child safety kit, which parents, grandparents, providers, health child care providers, anyone can get these kits if they would like to have them. We also have the family information guide, which the family information guide is basically a brochure with all the vital information in case of an emergency, who is to be notified, is there a will, is there a safety deposit box, are there life insurance policies in place, how do you contact those companies, financial information, and so on. So that is a really good tool and a great way to have a conversation with your family on just what to do in case of an emergency and how to handle that. This is an example of the AIL Plus health savings discount program. So you can see here, it says 1-year membership at no cost. Right now with our program, we started this in 2020. We are not charging any members of our groups that we work with to be a part of that program. All they do have to sign up and get an access code to access the portal, either on a computer or using their phone with an app, just to see where they can get their discounts. And basically they put in their address, put in what service they need, and it kind of shows them either a location or price point of where they can save money. So it's a very handy and useful tool to save on, as I mentioned before, pharmacy, vision, dental, telemedicine. That actually is a $35 copay. So if a member does want to do that, that is something they'd have to pay for, but that sometimes is a lot cheaper than an in-office visit with a higher copay. But they also include chiropractic care, durable medical equipment, diabetic supplies, hearing aids, lab testing, MRI and CT scans, and they've added vitamins. So again, we bundle these items with a $2,500 AD&D benefit, the child safety kit, the family information guide, and the AIL Plus discount program as a bundle of benefits at no cost to you or your member. How do we get this information out to the members? Is we do a notification of benefits or a letter just to let them know they have the $2,500 accidental death and dismemberment benefit. If they would like to name a beneficiary, we do send out a reply or response card. This is a sample of one of my credit unions in Warner Robins. And basically, it just asks for the date of birth and their information here. And this box will be the member's name and address already pre-labeled. And then if they would like the credit union to contact, this is a spot where you can actually put things that you want to promote, a Visa card, loans. A lot of my credit unions are doing certificates or CDs to generate some deposits. So there's a lot of good, things that you could put there to kind of generate that income. And this is basically a standard letter. We are a heavily compliant company, our industry, as well as credit unions. So we do just have a standard form letter. We just put the logo of the credit union or the group and personalize it with the signature from one of the leaders. Maybe Mr. Middleton would want to do that. This is, I hope you guys can see this and it's large enough on your screens. This is our loan generated income potential. And I just did a quick snapshot of based on your membership of 2,100. The response rate of about 15% response rate is what we average. The number of loans you currently have by the dollar amount, your average loan, according to your last call report, is about $9,500, probably a lot of auto loans. Basically, we get anywhere from 20 to really 40% return on the reply card of the survey questions that are completed by the member. And that could be anywhere from 68 to 97 members, meaning that they are showing interest in a loan product, a CD or something. If they're interested in a loan and you're averaging about $9,500 per loan, if you can convert 30% of those members that respond, you could generate anywhere from $193,000 to $277,000, which is probably not bad. The better the conversion, the more money you could make, of course. But this is a really good opportunity for you to get some warm leads and convert members into additional loans. We actually deliver on our promise. We want to make sure that we provide good service for your members. We have feedback from the response card on the credit union. We outreach to the member to schedule an appointment, usually over Zoom, especially since your membership may be nationwide. We provide individual certificates of coverage and verify their beneficiary. They can have a certificate for the $2,500 AD&D if they would like one, but it is not a requirement since it is a blanket policy. But a lot of people do like to have that individual certificate in their hand. We also present the information on the AIL Plus service, health service discount program, deliver any child safety kits they may want, and the family information guide. They just review it and we'll send this out to the members if they would like it. We also provide the members with a personalized need-based analysis. We just explain who we are, what we do, what we offer, and then if they have a need, we hope that maybe they would look to us as a partner of the credit union to maybe purchase insurance either now or in the future. I've had a lot of credit unions and a lot of credit union members really interested in insurance and wanting to know a little bit more about how to plan for their financial future and just being a good financial steward and have a plan in place for their family. These are just some of the supplemental insurance policies that we sell. We have a very small portfolio of products that we sell. We basically have whole and term life, accident policy, cancer, terminal illness, and we have like a Head Start policy as well for children if you would like anybody was interested in a life insurance policy for their child. One thing that's a little different with us is we have an added protection of a strike and layoff waiver premium, meaning if someone is laid off or on strike with their company, we can waive premiums for any policies they purchase for 3 months, sometimes up to 6 months, depending on the situation. What is nice also about the waiver is they don't have to pay those premiums back. Those are just simply waived due, while they're in their hardship or while they're in their strike or layoff. We actually did this during COVID and even extended it to 6 months. which allowed a lot of folks to continue to keep their life insurance policy that they wanted, even during a pandemic. So I think that's something that's very valuable. Just a quick note too, our policies are for working families. They are small policies usually. Our average price point is about $40 a month is what people spend on policies. And they're usually the freedom of choice, which is sort of a burial policy, or could pay for a funeral in case something happens. I do have reference letters that I can send out to you as well. These are just examples of two of the credit unions I work with: Georgia Guard Credit Union in Macon and AGA Federal Credit Union in Warner Robins. But I do work with many throughout the state of Georgia. Next steps. If you like the program, you're interested in going to the next step. Basically, we have a signed policy application. It is not a contract. It is basically a form to sign so that we know how many members to cover for the AD&D. We ask for a letterhead, envelope, and a signature to go on that letter or notification of benefits.
We do ask for a membership list, but it is through our secure server. We really just want names and addresses, and we just send those out. All of my credit unions use the secure server. You get a unique username and password, and that is easily done. I work with, I met with Lita through working with Peach State, which I do work with Peach State Credit Union. And so she could probably easily do that, just the names and addresses, so that we could get the letters out to the members so they are aware of the program. I can do a staff orientation, which that's probably Lita. So that would be easy enough, and I can provide her tools and information, and of course samples of the letter and things like that in case members have questions, and I would be her point of contact if she needed me to help with a member
or they had additional questions. I can also do membership meetings if needed, but you know, it depends on if you have those. I can do those remotely or in person. I've done those with credit unions in the past. I want to thank you so much for allowing me a few minutes to talk to you about our program and to explain a little bit how we can help and enhance, you know, the products, the income generated for your credit union. So if you have any questions, please feel free to reach out. I'll be happy to send this presentation to Mr. Middleton so that he can share with you. Thank you again, and have a great day.